Good morning. Welcome to the Point. If you live in Michigan and if you drive a car, you have to have insurance. It's mandated by law, and not just any insurance. It's Michigan's no-fault insurance, which comes with that catastrophic claims fund, that unlimited lifetime guaranteed fund if you are catastrophically injured. Well, in Lansing over the past 2 decades, there's been a lot of talk about reforming auto no-fault and exactly what that might look like. That conversation is happening once again. We went to Lansing this week to talk to one of the people who serves on the committee looking at no-fault reform, Representative Tim Greimel. Representative, I have said this a number of times to any number of elected officials. This is the subject I've covered more than anything since I've been here for a couple of decades. And members before you have wrestled with what to do about auto no-fault. And I know you recently sat through more than 8 hours of hearings as we sit here now after before this airs, but before we have this discussion, you're going to have another hearing on auto no-fault. First of all, what is it that the current bills are trying to do, and from your perspective, what should they be trying to do?
Yeah. Well, there are a number of aspects of Mayor Duggan's proposal that we like. We like the fact that it reins in exorbitant fees charged by providers to auto insurance companies. We like the fact that it puts in place a fraud authority to crack down on fraud and waste in the system. We like the fact that it puts some boundaries around attendant care so that family members aren't just milking the system. So there are a number of provisions in there that we think make sense, that will rein in costs, but there are also some real problems with the bill. In particular, the bill really only provides premium savings for those who opt for an inferior, lesser coverage. And the other problem with that is that as people opt for these lesser coverages, what ends up happening, and we just got a House fiscal analysis the other day on this, is that it shifts the burden to taxpayer-funded Medicaid to the tune of $150 million per year. That is of grave concern, as well as the fact that this generates a lot of cost savings for auto insurance companies, but none of the savings under the bill is passed on to consumers, the actual insureds, the drivers in the state, unless they opt for this lower coverage plan, even though the savings through the fee schedule on providers, through other provisions, the fraud authority, those savings are going to be recognized for all policies, and yet all drivers won't see the benefits. We'd like to see a number of changes to this. We want to make sure that we're not cutting benefits. We want to make sure that all drivers see a real savings as a result of savings that the auto insurance companies are going to see. And really, we want to make sure that the people who are primarily benefiting from this are drivers, Michigan residents. Right now, the insurance companies, as the bill is currently written, would see a huge cut in their costs, but pass on very little of the savings to consumers, ultimately just boosting insurance company profit.
I was shocked to learn that there are people, probably in your district, paying $5,000, not everybody, some people paying $5,000 a year for automobile insurance. Compared to my experience, and I feel like my insurance is exorbitant, but it's nowhere near that kind of cost. So I get actuarial tables, and I get that there are different risks in different places, but are those risks really that much greater in your district or in districts to your south where a lot of that is focused?
Well, the short answer is no. Certainly there are some increased risk based on geography. In some areas, maybe there's more auto theft, for example.
Well, and more traffic, right?
And more traffic, that's exactly right. But what we see is that the insurance companies end up charging much higher rates that aren't justified based on the risk to the vehicle or driving factors, and are instead based on things like people's credit scores, based on zip codes, based on gender. Women typically are charged more, for example, which is outrageous. And we need to put an end to charging people higher premiums based on those kinds of factors.
So would this current bill take some of that out of the system?
It really wouldn't. The only thing that it does is prohibit the use of gender and marital status in the setting of rating, something that we support. although arguably that's already against the law and simply isn't being enforced. But we certainly agree that we need to prohibit the use of marital status and gender in the setting of rates, but we need to go further than that. There's no reason why somebody's credit score, somebody's educational level are used by insurance companies to jack up the rates on folks, and unfortunately that's what the insurance companies are doing. We need to end it.
Let me ask you, with respect, about the reduction of cost. And as you accurately point out, the reduction in cost only comes for the catastrophic care part of your insurance policy, and only if you, I shouldn't say dramatically, you either have an unlimited lifetime benefit for which you would pay the same.
Sure.
I think there's $500,000 and a $250,000.
Yep.
So you have to cap yourself at $250,000 to realize the savings. But the savings is only on that part that you pay, and it only ends up being somewhere in the neighborhood of 18 or 20%.
Yeah.
Is that right?
Well, that's exactly right. The number of 40% has been thrown around, but that number is just on the personal injury protection portion of the policy, which for most Michigan drivers is less than half of the premium. And so the actual savings as a percentage of the overall total premium is much less, and again, only for those who pick lesser coverage. And again, as people select lesser coverage, what that's going to do is actually burden the state taxpayer-funded Medicaid system to the tune of $150 million per year. I would go a step further, though, and say it's even worse than that, because whatever savings there is for those who select this lesser coverage, that's only there for 5 years. After that, under the bill, insurance companies would be able to jack up their rates willy-nilly, just like they do now.
You are one who has dealt with this issue. Obviously, you sat on the committee. You had a lot of questions during that really long session. We've got some really strong players involved. Obviously, the insurance industry and their lobby is very strong in Lansing. Medical and healthcare facilities, very big industry and very strong lobby in Lansing. There are some attorneys that are involved on both sides, that get into litigation. They have a strong lobby.
Sure.
How difficult, well, I won't ask it that way because I've watched how difficult it is, but how likely is it that you can take all of those different groups and at long last bring them together and say, look, this isn't about you insurance companies or you healthcare providers or you attorneys. It's about ratepayers and about Michigan not being so high, among the highest in the nation with auto rates.
Well, you hit the nail on the head. I don't know how likely it is that any of these interest groups are ultimately going to agree. The real point is, it doesn't matter what they think. We should be focused as legislators, as policymakers, on what's good for the public, what's good for drivers and Michigan families. That's the key. And the key to doing that is making sure that we're reducing auto insurance premiums for Michigan families without cutting the benefits that those who are in catastrophic accidents need for long-term care.
You're an attorney and you understand how some of these things play out. And I want to ask you from your experience, if you know this, we hear these stories about how an MRI, if you and I would go in and say, our general physician referred us because we're having an issue, we have an MRI, we pay this much. If I'm going in because of an auto accident, I'm going to pay this much. Is that in fact true? And if so, how is that allowed to happen?
Yeah, it's a very serious problem. It is in fact true in many instances. One of the things that I and many others support is what I termed earlier as a fee schedule, something that would prevent hospitals and other providers from charging these exorbitant fees. There's no reason why someone who's treated with auto insurance in a hospital should have their insurance paying the hospital a lot more per procedure than somebody who's treated under their health insurance. And we need to put an end to that kind of price gouging.
When you think of this, we touched on it a little bit, you don't know what the probability is, but when you look at the current bill the way it is it fair to say that that's probably not the final incarnation of any change that happens?
I think that's probably right. There's some very serious bipartisan opposition to the bill as it's currently written. There are both Democrats and Republicans alike who say, wait a second, the right approach to bring down premiums is not to gut benefits that people need after they're in accidents. It's not to burden the taxpayer-funded Medicaid system. Taxpayers pay for enough services in this state. And so I think the key is working in a bipartisan way to keep the interests and well-being of Michigan families center and the main focus here, and not go along with special interests.
There were two major hearings held on that subject this week and still no conclusion, and don't expect any fast answers. The legislature may continue this conversation, but what the final program looks like right now is unclear. We'll continue to follow that and have more To the Point. Welcome back to the Point. You just heard an extended conversation about auto no fault and what may be happening in Lansing. During our next interview, that conversation comes up again. But first, we talk with freshman Representative Jim Lilly from Ottawa County about some of the issues he is pursuing in his first ever session. Representative, let's talk about something that happened this week. It's a resolution, and resolutions obviously are suggesting what the sense of the House might be. But this one is interesting because of the makeup of the people who voted for the resolution. It was your resolution. It was about immigration. What did it say and who voted for it?
Yeah, so let me talk to you a little bit about HCR 15. So this House concurrent resolution really looked to sort of call on Congress to take up immigration policy, take up sort of a comprehensive look at where do we need to be, in the country, what can we do to really ensure that our long-term, physical and economic security is ensured. And so this resolution calls on Congress to take up that issue. It highlights the fact of how much participation in Fortune 500 companies we have in Michigan that were either founded by immigrants or the children of immigrants. It really talks about how important immigration is for our agricultural sector in Michigan. And so highlighting a couple of those things, bringing together parties on both sides. We had over 50 co-sponsors on this particular resolution, 30 of which were Republican, 20 of which were Democratic. And I think I probably could have gotten more if we would have had more time. But by the time we finally got it drafted and put together, I wanted to make sure to get it through the House. So we moved that through our competitiveness committee, passed unanimously there, and moved it to the floor for a voice vote. So.
One of the other things that you've been working on, and I should point out you come from a financial background, so if you were in the business of making loans, for example, you would want to know everything about the business or whatever it was you were making a loan on. And it's kind of analogous to something you're working on. We're familiar, many of us who cover federal politics are familiar with the CBO, the Congressional Budget Office, and they score bills that go to the House and say, we think, and they're not always right. Sometimes they're very wrong, but we think this bill will cost or save the government this much money or have this impact. Here in the state, we have something similar, not nearly as big or as broad as that, but you would like to see more conclusions being brought to the legislators about bills before they're voted on.
I would, and I think to have that jumping off point to understand how this legislation is going to impact us financially, both at the state level, but also at the local government level, is really important. So I've got a fiscal note bill that it sort of better leverages our House and Senate fiscal agencies that we have here in the state of Michigan to ensure that in the event that they have to report that a bill is going to have an indeterminate fiscal effect, we at least know what sort of work went into coming to that conclusion. And I joked as I was testifying in our Government Ops Committee on this particular bill when it came up for a hearing recently that it's somewhat ironic that my fiscal note bill has an indeterminate fiscal note attached to it. And really, again, it's sort of emblematic of the issue. And I think, and I can't remember exactly because it's been a couple months now, but roughly half of the bills that we were looking at the week before on the House floor essentially had the same situation where it was an indeterminate fiscal note. So I think there's some things that we can do. We can clarify, sort of requiring House and Senate fiscal to sort of describe the process that they've gone through, what local folks they've talked to in determining the fiscal impact of a bill. But I think there's some significant opportunity there, and I think there's some appetite to do it amongst some of my colleagues too.
And it's fair to point out that when we talk about the CBO, that is a big, sprawling governmental agency in Washington, and the folks who do it here at the state are many fewer and not nearly as big a group.
Yeah, and I think they're really good. I actually think what is worthwhile pointing out with this is I think some of this work is being done already anyway. It's just a matter of sort of requiring it to be part of the package and having it be accessible and transparent both to legislators but also to local folks that this stuff's going to affect.
All right, we know we've talked about teacher retirement or state employee retirement or those retirement funds that are dealt with largely from the state arena. That's a big dollar figure. The governor was really pushing on that. But there is another group of people who also have retirement systems that are underfunded out there. And this is a little more complicated because it's not everybody everywhere. For example, in my county, they might be perfectly well funded, or in my township or my municipality. But these are workers who are working at the more local level, and you think something needs to be done about that.
I do. So, when we look around the state, and we look at various municipalities, everybody's handling their pension and employee benefits differently, particularly those for retirees. So a lot of these local municipalities have promised health care benefits to their retirees, but haven't necessarily pre-funded some of those benefits. There's some pension implications here too that are also important, but at the end of the day, I think the state needs to take a hard look at how do we help these municipalities sort of figure out whether they've got an issue or not. How do we put a system in place with maybe some guardrails that allows local municipalities to continue to really offer whatever benefits they want, provided they're funding those benefits? Because as we saw in Detroit and in some other instances, we have to worry if a local municipality becomes insolvent, there's a certain implication from a state perspective about stepping in. And ultimately, what we want to do is ensure that employees who are promised benefits get to collect the benefits that they're promised. And sometimes, because we live in a political age where we have term limits, where we have changeover, it's very easy to make short-term promises and not really have to worry about the long-term implications. And this is sort of an opportunity for us to step in and get everybody in a conversation about what the long-term implications of these are, and try to make sure that folks have a plan in place to make sure that everybody is able to collect what they were promised.
Part of the difficulty with that is, though, what we talked about at the outset, and that is some places have done this just fine.
Yes.
And to impose a one-size-fits-all approach on some of those that might even interfere with what they're doing would seem to be unfair to try to fix the others who haven't been able to do that. So this becomes complicated.
I agree, but that's why I think as we think about this, we're not necessarily prescribing a fix. We're more trying to prescribe a metric by which things are evaluated. And so, again, communities will have a lot of different approaches to this, but what I think we want to make sure of is that everybody's got a plan, and that plan is reasonable in terms of reasonable assumptions and implications. That's what we saw during the MIPSR's discussion on teacher pensions, is that the reality was a lot of the assumptions that were baked into that system were just clearly unreasonable. And I think for everybody to be sort of playing under a same set of assumptions will be very helpful to us in understanding where the problems are.
All right, let's talk about an issue that I have covered since the first day I walked into the Capitol building. It's older than you are, perhaps, as an issue goes in this state, and that's doing something about the no-fault auto insurance system that we have in the state. And to start with, we know it's the most generous with an unlimited lifetime benefit for catastrophic injuries. We also know that the rates are some of the highest in the country, particularly depending on where you live.
Yep.
I've heard what I think are horror stories of people maybe spending $5,000 a year to insure a car, which is clearly not affordable for anybody. I mean, that's an amazing amount. But coming to a resolution is going to be tough. Now, the mayor of Detroit and the speaker have come up with an idea that would actually mandate a price rollback. That is not something that has yet come out of committee as we speak,
right,
and probably will not by the time this airs on Sunday morning, and may not at all, given that may not be the answer.
Yep. So this is a very, very complicated issue, and ultimately, I don't sit on the insurance committee, so I didn't sit through the 8 hours of testimony yesterday on the bill, but it is something that I'm in the process of reviewing. And what you really find is that the issue is complicated, and I understand why maybe there hasn't been a resolution to it at this point. Clearly, there's two very different sides on this issue, and there's not a lot of common ground between those two sides. And I'm nervous that what happens this time is maybe the same thing that's happened before, where the outcome is literally nothing, the status quo. And what's unfortunate about that is, well, there's some things that sides are never going to agree on. There's some opportunity to do a few things that, well, probably they won't reduce rates by 20%, like I think a lot of these plans could potentially do for some folks that choose a lower level of coverage. I think there's some middle ground that can actually help everybody. And nobody ever really wants to get there because, a 5 or 10% rate cut is not particularly attractive to a lot of people, but it's still progress. And I hope that we take a look at those things and try to figure out a way. We need to do something with attendant care. We need to do something with a fraud authority. I mean, we should probably do something on assigned claims, addressing the Covenant case and getting that codified in law. And there's also even some opportunities to do some special things for seniors and make sure that their medical portion of their auto benefits are essentially covered by Medicare, but still providing some wraparound services. So those are just 5 things that I kind of rattle off the top of my head, where I think if it really came down to it and said, if we can't get comprehensive reform done here, what should we do? I would argue we need to make sure that those 5 things happen, and I hope that our constituents hold us accountable to making sure that at least something happens here.
Well, those first 3 were addressed in a series of bills that came out of the Senate that the House could still act on, as far as I understand the way the process works. But they're not going to.
Well, and I thought that was last session. Maybe I'm wrong about that, but I think it was last session. Clearly, there's been a lot of talk on the other side about those things, at least 3 of those things being part of it. I think some of the other things I mentioned, there's also some room for compromise there. But again, I get it's not the massive reform that everybody likes to run on, but I like to think that my constituents sent me here sometimes for just marginal improvements. If we can't get everything, I think this is at least a win to get something.
We were going to talk about the driver responsibility law, and we're almost out of time, but quickly, it is something, again, that has been proposed to just do away with it. There's already a phase out of part of it. Speaker Linder says he wants to get rid of all of it and create an amnesty without getting into all of the details, and I apologize because we did run long. Is that something you're willing to look at?
Absolutely, and I think we will be taking it up in our competitiveness committee next week. Speaker Chatfield, our Speaker Pro Tem, is actually chairman of that committee normally, so he'll likely testify on those bills. I'll probably take the gavel for a short period of time, but I think it's absolutely something that we need to talk about and look at, because realistically it's a pretty regressive tax. People are not employed because these things exist, and I think we've got to look at the long-term potential of accelerating that phase out, which is what these bills really do.
As for our discussion about those Senate bills that were introduced and passed, Representative Lilly was right. Those were in the last session in lame duck. That means they've expired and cannot be acted upon, although similar legislation could be reintroduced. We'll wait and see exactly what happens in the Senate, in the House, and what, if anything, happens with reform of auto no fault. And we'll have more to the point. So the conversation continues about auto no fault here in Michigan. What exactly would some type of reform look like? Would it really bring lower rates? Would it bring adequate coverage? Those are some of the questions that lawmakers are talking about right now. That's why those 2 hearings in Lansing were so important this week, and there will be more. And to be sure, other legislation is going to be introduced that could impact auto no-fault reform. It's all part of the reason that we will continue to go back to Lansing and talk with our lawmakers during the week and here on Sunday morning to find out exactly how that impacts you, your coverage, your rates, and exactly what happens next. I hope you'll join us next and every Sunday morning at 10 o'clock right here on Wood TV 8 for To The Point.